Welcome, CDI specialists, coders, and clinicians. In today's explainer, we're taking the past medical, family, and social history from a routine, honestly kind of boring administrative chore and turning it into your ultimate medical legal shield. I am so thrilled to guide you through this today. We're going to look at how shifting away from volume-driven documentation toward a clinically grounded, highly specific approach doesn't just ensure accurate reimbursement. It fundamentally protects your practice and, most importantly, your patients. Okay, let's dive right into this.
You've definitely heard this one before. If it's not documented, it wasn't done. Well, it's a classic medical legal adage for a reason. Now look, I know it's virtually impossible to perfectly capture every single tiny nuance of a patient encounter, but the core principle here is absolutely crucial in a legal context. Why? Because litigation often happens years, sometimes many, many years after a clinical encounter. Your documentation is literally your only definitive proof of the care you provided and how the patient responded. It is, without a doubt, your ultimate defense.
So, here's our game plan for today. We're going to systematically cover PMH fundamentals, mastering allergy documentation, family history and heredity, social history and lifestyle, cultural and diversity factors, and finally, the medico-legal imperative. Let's get to it.
Section 1, Past Medical History Fundamentals. We're building the foundation here.
So the past medical history, or PMH, this is the bedrock of your patient's clinical narrative. It chronicles their past and current health status. Now, to avoid vague, messy charts, we have to structure this using specific subheadings. You want to clearly state if an ongoing chronic condition is stable, uncontrolled, or resolved. For the surgical history, don't just jot down the name of the procedure. We need dates, the type of anesthesia used, and, this is a big one, any complications, like severe bleeding or malignant hyperthermia. And when we talk about medications, a complete reconciliation is vital. We aren't just talking about prescriptions. You need to include herbal supplements, vitamins, and over-the-counter products with their specific dosages and frequencies. Trust me, getting this right prevents incredibly dangerous drug interactions down the line.
Moving right along to Section 2, Mastering Allergy Documentation. Precision here is absolutely key.
Look, when it comes to allergies, a simple lack of detail can literally result in severe patient harm, not to mention massive legal liability. Did you know that up to 25% of ambulatory patients experience adverse medication events? And so many of these are preventable just by properly documenting allergies. We have to make a critical distinction here. You must document the exact manifestation of the reaction to separate a true drug allergy from a standard adverse side effect. Patients will constantly tell you, "Oh, I'm allergic to that medication," but what they're actually describing is just a side effect. A severe rash or anaphylaxis from penicillin, that's a true allergy. But a cough from an ACE inhibitor or feeling really nauseous after taking codeine, those are adverse side effects. Documenting the specific reaction, like writing heparin, hives, allows the next provider down the line to make an informed call on whether the benefits of a drug actually outweigh the risks.
Oh, and another thing. You absolutely must explicitly ask about and document latex and environmental allergies. A latex allergy is a huge operational detail because it means you need specialized equipment during the patient's care. Imagine a patient gets admitted for surgery and has an undocumented latex allergy. The results could be catastrophic. Environmental allergies, like being allergic to cats or pollen, should go right here too, unless you're actively treating them for it. In that case, pop it into the medical conditions list.
All right, Section 3, Family History and Heredity. It's all about tracking risk. Let's zoom out a bit to family history, which is super important for stratifying patient risk based on genetics. We need to systematically capture data on first-degree relatives. We're talking blood relatives here, parents, siblings, and kids. Spouses and in-laws, they don't count for this. You need to record their current age and health status, and if they've passed away, you need their age and the exact cause of death. What we're really doing here is hunting for hereditary red flags. Think early age of onset for a disease, or maybe 2 or more first-degree relatives with the exact same disorder. Spotting a strong family history of cardiovascular disease, diabetes, or specific cancers requires immediate clinical surveillance. It can literally rewrite a patient's entire preventative care plan.
Section 4, Social History and Lifestyle. This is where we build the complete patient profile.
So, transitioning into social history, this is where we identify external and behavioral risk factors that drastically change a person's overall health. Let's talk about the biggest behavioral risk factor out there. Tobacco use is the leading preventable cause of premature death. It is responsible for a staggering 480,000 deaths annually in the United States alone. That is nearly 20% of all deaths. This is exactly why our documentation of it has to be flawless and mathematically precise. It impacts everything from cardiovascular risks to respiratory recovery during surgery.
Because of those massive stakes, writing down a vague note that a patient smokes just doesn't cut it anymore. As CDI specialists, we have to make sure clinicians calculate and document a highly specific pack year history. The math is super simple. Just multiply the packs per day by the total number of years they've smoked. So, 2 packs a day for 20 years? That's a 40-pack year history. You also need to document smokeless tobacco. And with the absolute explosion of e-cigarettes and vaping, you have to specify the device type and how often they use it. If your software doesn't have a neat little drop-down for vaping yet, just use the free text comments.
Now, modern electronic medical records are fantastic for this. They give us specific fields and checkboxes to capture all of these detailed histories, letting us build this really comprehensive profile that essentially travels with the patient. EMRs are amazing at tracking diagnostic tests and sending us pop-up alerts for drug interactions. But remember, they are only as good as the data we feed into them. We have to utilize these fields accurately.
To get that good data, we absolutely must eradicate ambiguous terms from the record. Take social drinker, for example. What does social even mean? Is that 1 glass of wine a month at a wedding or 5 drinks every single night with buddies? We have to replace those vague terms with specific quantities and frequencies. Better yet, use validated screening tools like the CAGE or audit questionnaires to clearly identify alcohol dependency. Beyond that, detail any occupational hazards. Do they wear hearing protection at work? What's their living situation like? And don't forget to note their educational background and literacy level. Think about it. A patient's ability to read directly impacts whether they can actually follow the written discharge instructions you hand them.
Section 5. Cultural and diversity factors. This is all about personalizing care.
A truly bulletproof history has to account for cultural, religious, and diversity factors. These can completely change a care plan, both legally and clinically. Take a look at this table. Under federal laws, like Title VI of the Civil Rights Act, hospitals are literally required to provide effective communication. That means you must document the patient's primary language and whether an official interpreter was used. And a quick heads up, using a bilingual family member absolutely does not legally cut it for informed consent. We also have to document religious beliefs that might lead a patient to refuse a life-saving intervention, like a blood transfusion, or even dietary practices, like fasting, which heavily affect their nutritional needs while they're in the hospital.
Finally, Section 6, the medical legal imperative, defense through documentation. So we reach the high-stakes medical legal reality of lifestyle counseling. Why are we meticulously documenting all of these risk factors if we aren't going to actually do anything about them? Check out this stark medical legal alert from our source material. A 33-year-old woman who was obese, hypertensive, and smoked visited her clinic regularly. Her tests clearly showed high cholesterol. Well, several years later, she suffered a massive myocardial infarction. She sued the clinic for malpractice, and she won. No way, right? But the provider was found negligent simply because they totally failed to document that they ever educated or counseled this patient about her severe coronary risk factors.
This proves it is not enough to just spot a risk in the social or family history. You have to explicitly document the education and counseling you actually provided to the patient. That's how you ensure clinical follow-through and malpractice defense. If a patient is obese, document that you discussed ideal body weight and the risks. If they smoke, document that you advised them to quit and offered cessation aids. And hey, even if they flat out refuse to change their habits or decline a screening, you have to document that refusal. Quote them directly if you can, and write down that you clearly explained the risks of their noncompliance. As a final layer of armor, make sure advance directives and healthcare power of attorney documents are officially logged right into the EMR. A healthcare power of attorney legally names a proxy to make medical decisions if the patient suddenly can't. It is so critical to ask about these documents before a crisis actually hits, ensuring they are a permanent part of the record to safely guide critical care and end-of-life decisions.
So as you evaluate your charts moving forward, ask yourself this question. Are you just going through the motions to get it done, or are you creating a robust, clear, and comprehensive record? By mastering the specifics of the past medical, family, and social history, you are ensuring clinical validity, supporting the absolute best patient care, and protecting both your patients and your practice. Thank you so much for hanging out with me today, and please like, share, subscribe to Decode Healthcare with Harshal.